Welcome back to my channel. Do you have hormonal imbalance? Your hormones, your health? Feeling bloated or irritable or just not your best? Shift in your hormone could be to blame. Hormones are chemical messengers that impact the way your cells and organ functions. So it is normal for your level of them to shift at different times of your life, such as before and during your period of pregnancy as a woman, or even during menopause or postmenopausal period. But some medication and health issues can cause your levels to go up or down too. Appetite and weight gain. You may gain weight during hormonal shifts, such as menopause, but hormone changes don't directly affect your weight. Instead, it likely happens because of other factors like aging or what? Lifestyle. For example, when you are feeling blue or irritated as you can be when your estrogen level drops, you may want to eat more, so which can lead to sudden weight loss. Your thyroid glands help control how fast your body turns food into fuel, as well as your heart rate and your temperature and all that. But when it makes too many hormones or does not make enough, your weight can drop, right? So if you have lost like 10 pounds or more, but haven't been working out more or eating differently, irregular periods, most women period comes every like 21 to 35 days. If yours doesn't arrive around the same time every month, or you skip some month, it might mean that certain hormones like estrogen and progesterone are too high or too low. Then of course, one of the symptoms is sleep problem. If you're not getting enough sleep, or if the sleep you get is not good, your hormones could be at play. Like for example, progesterone, a hormone released by your ovary, help you to catch sleep. But most of the time, if it is not enough, it can happen that you might not be able to sleep well. Chronic aching, a breakout of aching or during your period is normal, but aching will not clear up. And if it cannot clear up, it can be a symptom of hormonal problem. It can be due to an excess androgens, that's the male hormone that both men and women have, can cause your oil gland to even overwork too. Then, of course, you can have memory fog. Though experts are not exactly sure how hormone impacts your brain, but what they do know is that changes in estrogen and progesterone can make your head feel foggy and make it harder for you to remember certain things or even keep focus. A dry skin, a shift in hormone can leave your skin parched. This can happen during menopause when your skin naturally starts to thin and can't hold on to as much moisture as it used to be. A thyroid issue could also be to blame in such cases. Belly problems, your gut is lined with tiny cells called receptors that respond to estrogen and progesterone. You understand? So when these hormones are higher or lower than the usual, you might notice changes in how you are digesting food. You understand? Of course, another symptom might be an ongoing fatigue. Are you tired all the times? Fatigue is one of the common symptoms of an hormonal imbalance. Excess progesterone in the body can make you sleepy. And if your thyroid, that's the butterfly shaped gland in the neck, you understand, then it can be night sweat. If you wake up drenched, low estrogen could be the cause. Many women have night sweat around the start of menopause. You understand? Then other hormone issues can cause them too. So, and some of the symptoms that we're still talking about is mood swing, and at times it can be as bad as depression. Researchers think drops in hormone or fast changes in their levels can cause moodiness and the blues. So, estrogen affect the key brain chemicals like serotonin, the dopamine, and norepinephrine. Then, of course, can be hair loss and thinning hair. When hormones like estrogen, for example, drops, others in your body like testosterone start to have a bigger impact, and the result is what? your ear thinning out or ear loss. It can be headaches. Lots of things can trigger this, but for some women, drops in estrogen brings them on. That's why it is very common for headaches to strike right before or during your period, right? When estrogen is on the decline. Regular headaches or ones that often surface around the same time each month can be a clue that your level of this hormone might be shifting. Then, of course, one of the symptoms is vaginal dryness. It's normal to have this occasionally. But if you are not up to menopausal syndrome, menopausal age, and you often notice that you are dry or irritated down there, low estrogen levels may be the reason. And this is the hormone that helps the vaginal tissue to stay moist and, of course, comfortable. So whenever you notice that your estrogen level, if your estrogen level drops because of an imbalance, it can reduce the vaginal fluid and moisture, and of course cause tightness and dryness. And at times it might be loss of libido. Most people think of testosterone as a male hormone, but women bodies make use of it too. If your testosterone levels are lower than usual, you might have less of an interest in sex than you usually do, like in menopausal women. Then, of course, breast changes. A drop in estrogen can make your breast tissue less dense, and an increase in the hormone can thicken this tissue, even causing new lumps or cysts or nodes. So what do you want to do? You have to talk to your doctor. If you notice any breast changes, even if you don't have any symptoms that concerns you, then of course test. Both estrogen and progesterone can affect the amount of water in your body, thereby leading to dehydration. When their levels change like they do before or at the start of your period, you can do yourself more testy than usual. So test can also be a sign that your body is not making enough antidiuretic hormone. We call it ADH, which is the hormone that helps you retain healthy amount of water. So whatever you are going through, it is better to see your healthcare professional for proper medical advices. See you in the next video.